Welcome friends. Today we have another session. We have Dr. Gideon Nyakudi. Today we are going to talk about burns. You know, in the household, that's the most common accidents that we get around the house. So welcome, doctor. It's your chance to talk.
Thank you so much, Nelly, for the opportunity. Viewers, today we are going to look at one of the most complicated and the most common
and
overlooked issues that we have in our communities. A barn. We know very well that in the creation of man, the very first thing that man discovered was fire. But then man has used fire to destroy himself. So burns are, what's a burn? A burn is the exposure of heat to a tissue. Heat that destroys a tissue, it's a burn. So burns can come in different ways. For example, you can have open flame burn, the flame of a fire which burns you. Maybe you're in a house or you are cooking in an open flame or you're using gas and then you have a burn. Also, we can have even a sunburn. You are exposing yourself to the sun but not knowingly the sun burns your skin. We can also have steam burn, where it's just like maybe a gas or very hot water which is burning, and then that steam can burn you. And also we have liquid burn. Back in the village we used to have very popular burn through porridge, uji, burning children with the uji when making the porridge, or tea for that matter. So we can have liquid burn, and also we can have gas burn. For example, gas burn, assume you are in a house which is on fire and that heat is so hot, and then you inhale that heat which comes in form of a gas. So those are types of the burns we can have. And also another burn I remembered recently, when we were young boys tendering or taking care of cattle, you might have, you're holding a rope and the cow is running and then it goes through your skin and
from
friction. Thank you so much, Nelly. Friction burn. So those are the types of burns that we have. When we have burn, our muscle, our skin gets damaged and then our muscle gets damaged, right? So there are about let's say 2 ways our muscle can get damaged. Number one, you can get a surface burn, or you can get a first-degree burn, which is an outer skin burn, the burn that goes into the skin. And then we have level 2 burn, whereby the damage goes to a second level called the dermis. So the outer, our muscle is made into 2 layers. There is the epidermis, the upper layer, where we can have a burn, but when we have severe burns, the burn goes into the dermis.
Is that when, because I've seen people get burned. You can get a burn and then like tomorrow it looks kind of dry. And then someone can get a burn and then when you look at it, it looks like it's oozing oil.
Good. Beautiful. So when you get burned on the epidermis, it kind of starts to dry out, because remember the dermis is where we have things like vein, where we have the muscle. So that one is very dangerous. When burn goes to the dermis, it causes more severe pain and damage because it's now affecting the inner muscle. It can even be affecting the veins, and that's the most dangerous type of burn that needs care, treatment right away. So as I said, the epidermis, the dermis, and also the degree of burn, the amount of service that somebody gets burned. And by the way, Nelly, let me remind you of one more important burn that we just mixed. The electrical burn,
Oh yeah.
which is now very common in our
Very
communities, because now the government is putting electrification in the community, and we have these young men who feel like they're genius. They can go up to that pole and connect the cable and their hands are insulated with their skin, and soon enough what we see is
And even stealing
burn.
oils.
Yes,
Stealing
very-
oil from the transformer.
from the transformer,
I've
stealing
seen it.
oil. You can steal it once, twice, but my friend, your days are numbered. That burn is very dangerous and it will kill you, electrocute you, and you'll die a really bad death. So there is that electrical burning also, we almost forgot about it. And so those are the different types of burn: the electric, the gaseous, steam, and also open flame, and the sunburn. Also we can also have laser. In treatment now, in the high level treatment, we have laser, which is set to maybe sometimes hit polyps, or maybe kidney stones. But when we don't have correct settings, the laser can burn you. So those are the kind of burns and the level of degree of burns. And the other thing I wanted to say about burns is about the children and burns. As parents, you can have a child burn, but you don't know the degree of the burn. As I was mentioning to another mama who was having a child complaining of a sore throat, burning throat, and as mamas back in the village, they put children in the back when they're cooking, and also they're burning that steam which is coming. In Swahili they call it muvuke. As it's coming from the cooking,
You're bending and
you are bending,
behind
you are burning your child on the
not
shoulder and not knowing. So those are the type of burns and the degree of level of burns. Allow me to mention something also very important. When people get burned, how do they die? What kills them? So in most burns, what kills people is sepsis. Once you get burned, and then say you get second degree burn, your veins and your inner muscle are affected. If there is an infection that goes to your bloodstream, it can kill you in a matter of minutes, hours, or just very few days. Because now your bloodstream becomes septic. You become sepsis, you become septic. So care should be taken on burn wounds. The way we handle burns when we are taking patients to the hospital, it's very, very critical to their survival. In that the way we handle somebody, the car we use, all the means of transportation to the hospital must be very, very clean. We must use very clean linens, and actually, if possible, we can even transport them without putting on clothes, in a clean linen, so that we minimize infection. And also, some of the burn patients also die from heart attack, because the fear of the pain itself, and also the infection can easily cause a heart attack. So in all these types of burn, we have to look at how we can contain fire, and then also how do we get treatment. Number one is being careful with fire. Stop stealing electricity. For example, when you need power, go get it the right way. Stop destroying the transformer. So these simple things we need to look at on how to manage ourselves will save lives. If you are having an open flame, know the amount of fire that you are lighting. Are you burning the entire forest? Can you be able to control this? So having fire is very important, but containing to the fire that we need, the amount of fire we need, is very, very important. And also it goes even the way ladies dress. Sometimes ladies have long piece. You find a lady, they are cooking, they have this long piece. That piece, remember, you use certain oil, which is
Or even-
highly inflammable.
Even the synthetic itself is nylon.
It's nylon.
Once you get a spark, it goes
It
burning.
goes pretty fast. So imagine you have this piece and you catch fire. Are you going to look for a knife and start cutting your
You don't
piece?
even think about it.
You didn't
just-
even think about it, you just grab it and you're spreading it. So we must control how we dress when we are handling fire, the amount of fire we have, and how to contain it. The last thing is about treatment.
Okay, doctor. Well, before you go to treatment, I have a question. When you were young, me in my family, where there is one of my brothers who was used to be moving up and down, so he was always getting burned. And when he got burned, we were supposed, since it happened very often, my mom would tell me, if anything happens, you get a cold towel, put it on to calm down. Then put not just Vaseline, not just little bit, a heap. You smear it, layer. So do you think, are we doing it right? Or, because every time my mom would tell me that, then by the time she comes, she takes him to the hospital, the doctor will be like, Mama, are you a doctor? Who told you to do this? Who was right there?
So I think it's the notion that we have, or our parents had, that something cold will neutralize something hot, which sometimes is not the case. So remember that when somebody gets burned, when you get that burn, the skin might continually burning, but you're not seeing it. All the muscle might be continually burning, but you're not seeing with your naked eye that that burn is going on. The second thing is, let's remember that oxygen supports burning. I think everybody who went to school learned that O2, oxygen, supports burning. And what's the composition of water? Hydrogen and oxygen, an explosion. So when you are giving a burn which is ongoing oxygen, actually you are enabling the burn because you are giving it more oxygen. However, if you have something like ice and closed where it does not release oxygen, maybe in an ice pack, in hospitals or in the developed world, we have ice packs. That those ice packs, we put them in the freezer. You can use an ice pack to make sure that that burning has stopped. After that, it's even better that you don't put anything there. You don't put a towel, because as I said earlier, you are going to create an infection. And also, different burns call for different methods of handling them. If it's an open wound or fire, sometimes very common during Christmas is cooking oil, mandazi oil, that you put some water and it explodes. So cooking fat oil is very, very common burns. And so every burn comes with a different way of treatment. And also, if I may proceed to treatment of this kind of patients, depending on the level and the type of burn, if for example you have a child who grabbed something very hot and swallowed, or maybe if you have somebody who was trapped in a house full of fire and swallowed very hot fumes, smoke, and sometimes that flying fire. And so this person is having a throat which is full of wounds. This person cannot really breathe well or open his mouth or even eat. So doctors can insert a tube, the GI tube, through the mouth to the lungs, to enable this person breathe, so that the oxygen is not going through the trach. Also, they can use a ventilator. They can put a tube and then a ventilator to enable this person breathe by bypassing the mouth, the normal mouth tissue, and the trach. Also, they can feed this person through using the G-tube. They can insert a tube through to the mouth, not to the mouth, to the stomach, and then feed this person, because this person at this point cannot be able to eat. Also, when this person goes to the hospital, if he has open wounds, there is also certain ways they can use water baths, not just running direct water, but there's some parts they use where water is in underneath, and there is a pad to cool this person. And also, especially in burn patients, they don't use linens, they don't use blankets. We use certain beds which don't have a linen to cause infection.
Okay.
So there are certain specialized beds that burn patients go to use, or we use in the hospitals. And the last thing I may say that if you are burned somewhere that people can see, like the face or something like that, doctors can do plastic surgery or grafting. They can go somewhere, grab a skin, and then use that skin to patch where you're burned. They can do skin grafting, or they can also do plastic surgery. So it's very nice, it's very important that once we have a burn, we make sure that that area is very, very clean. There is no infection, and we seek medical treatment right away. That's what I can recommend about burns.
Okay, my friends, that's all we have today. Burns is a wide topic. Sometimes at back, we'll go back to the topic and we'll expound on the topic. So that's all for today. See you next time. Bye.
Bye-bye.